Dr. Rehna, Assistant Professor and Retina Consultant at Amrita Institute for the last set of cases on adult retinal tumors. I think we started 10 minutes late, so we have enough time.
Good afternoon. First of all, let me thank KSOS Scientific Committee and Dr. Nadasha for giving me this opportunity. So mine is adult retinal tumors. So I have here a 21-year-old lady who was diagnosed with von Hippel-Lindau disease and was referred for ophthalmology evaluation. VHL is strongly associated with retinal angiomas. She had history of cerebellar hemangioblastomas before and underwent excision. But she was not symptomatic in either eye. Anterior segment was normal. Visual acuity, best corrected visual acuity was 6.6 in both the eyes, and intraocular pressures was 16. So that is the fundus appearance. The disc in the right eye showed reddish orangish lesion, which was occupying the inferior half of the disc with obscuration of the margins. The upper half of the disc was appearing normal, and then there was a vessel vein which was dilated tortuous, which is going on to the temporal periphery, and which ended up in a lesion which was about 3/4 disc diameter in size, about the same color with a feeding arteriole. So that appearance is very typical of retinal angioma in a VHL patient. So in the left eye, clinically we couldn't see any angiomas, either in the posterior pole or in the periphery. And doing fundus fluorescein angiography, the lesions which were seen in the right eye appeared hyperfluorescence, but there was no leakage. And in the left eye, even though clinically there were no lesions which were found, we could see some hyperfluorescent lesion supratemporally and inferiorly in both the eyes, which could be the early angiomas, which was not clinically visible. So treatment-wise, she underwent laser to the angioma, laser photocoagulation, to the lesion, which was seen temporarily, and to the feeding arteriole, which was low energy, long duration shot. 3 sittings had to be done to cause complete regression of the lesion. And regarding the disc angioma, we decided to leave it alone. And the small angiomas, which was seen on the fundus fluorescein angiography, was also lasered. So that was a picture post-laser photocoagulation in the right eye. And that was the one in the left eye. So then she was kept on follow-up. The disc angiomas was just observed. And after 2 years, we could see that the lesion has actually enlarged in size on the disc a little bit, but still the visual acuity is maintained at 6.6 with no edema or exudation. Meanwhile, new angiomas appeared in the right eye in the periphery, which was also lasered. So at the point, we are just observing the patient. So take-home message, all retinal angioma patients to be referred for the care of potentially lethal von Hippel-Lindau disease. And FFA helps to know small angiomas that are not clinically visible, and so we would advise doing FFA for those patients who don't have clinical angiomas, and regular ophthalmic evaluations for individuals with VHL to offer timely treatment for active new angiomas. And all those angiomas that could be safely treated should be treated. So that's, thank you. And questions to the panel. What would be the management for the disc angioma, which is, we are observing them now, observing the angioma now. Will you consider PDT or anti-VEGF, or in the future if she develops further exudation or edema? And would you recommend doing FFA for all the patients of VHL, even though there are no clinical angiomas?
FFA is definitely recommended because FFA you will by and large discover more angiomas in the same eye or the fellow eye sometimes.
Okay, sir.
See, that is 100% true. Regarding your first question, you see I have had experience of direct laser also. Direct laser close to the disc, touching the disc margin also. But the only good point in your patient was vision was 6/6.
Sir.
So ultimately all of us are responsible for vision, so therefore I would not advocate doing anything heroic in a 6x eye.
Okay, sir.
But if the lesion is progressing,
Yes.
I have done low fluence PDT right over the disc also, and that does along with the IVTA, because IVTA does wonders in such patients, in patients of angiomas. So a combination of low fluence PDT plus IVTA in patients where angioma is increasing or there is a exudation in the macula.
Okay, sir.
So I was not fortunate to have 6 by 6 vision. 6 by 6 vision, I would agree with you, laser to the peripheral angiomas and observe the disc till the time it visually misbehaves.
Yeah.
But low fluorescence purity in literature has been advocated for such tumors.
Okay, sir. I'll go to the second case.
Yes.
So the second one is a 19-year-old girl who was referred again for a lesion in the left eye for which she was asymptomatic with a visual acuity of 6.6 in both eyes with no RIPD, anterior segment intraocular pressure normal. So that is the fundus appearance. The right eye was normal. The left eye, again there was an inferior lesion which was elevated, obscuring the margins with fluffy borders with hyperpigmentation on the surface, which is very much suggestive of optic disc melanocytoma with the vessels appearing tortuous. So the fields was showing a small paracentral scotoma, and the disc showed the swelling of the peripapillary RNFL, which was due to the lesion itself. So this is a benign case of melanocytoma, and we decided to observe the patient. She was advised for yearly follow-up. Then she turned up only after 3 years, and she was still asymptomatic, and the visual acuity is 6.6, but she developed a definite left eye RIPD. And you can see from this picture that the left eye, after 3 years, the lesion has increased in size. It had become more elevated, area has increased, pigmentation has increased, but there was no edema. And you can see even the fields were showing significant enlargement in the scotomas. And again, from the OCT RNFL, we can show increased thickening compared to the previous one. So if you look at the OCT through the lesion, there is a hyperreflectivity at the anterior border due to the pigmentation and the abrupt posterior shadowing due to blockage of the light transmission. So we were wondering whether it is a benign enlargement or is it an ischemic necrosis of the melanocytoma or is it malignant transformation. So even though malignant transformation is not common or is it rare, it's still reported in the literature. Shields et al. Has described 1 to 2%. So the next few slides I'll go through the investigations that we have done to know whether it is malignant or not. So fundus autofluorescence, it showed hypoautofluorescent lesion at the melanocytoma, in contrast to melanoma where you can sometimes get hyper due to the lipofuscin deposition. And in FA, the lesion itself was appearing hypofluorescent. There were no abnormal vasculature, no abnormal leakage, which is also against a malignancy. And B scan showed a solid lesion, but if you look at the reflectivity, it's a high surface reflectivity with moderate to high internal reflectivity. It's not very clear, but in melanomas, it is low internal reflectivity. And the MRI brain and orbit also showed no optic nerve infiltration. So we decided to observe our patient, and the patient is yet to come for follow-up. So to conclude, careful evaluation, periodic checkup, and long-term follow-up is required for this patient. The vision loss in our case may be due to axonal swelling secondary to compression of the nerve fibers by the lesion. We need to follow up the patient and see, and follow up with serial sphincter photograph. Ultrasonic measurements is essential to confirm the diagnosis and decide on further management. Thank you. My question, would you be observing the patient and would you be doing something different?
Thank you, Dr. Rehna. So Dr. Lalit sir is very clear that he has not seen malignant transformation.
Frankly, we have seen, optic disc melanocytoma, but I have never seen malignant transformation. So by and large, but 2 studies you showed now, autofluorescent and FA and ultrasound, they will tell you. But by and large, transformation, I have not seen malignant transformation of disc melanocytoma.
Okay, sir.
If anybody else has seen, he can contribute.